and kind of walk through a slide presentation. It's short, but there's a video in there that I'd like for you to watch that'll probably speak more than I'm speaking, because you'll see exactly what we're doing, how we do it, and at least you'll see a lot of the kind of things we do on a routine basis. It's not the exception to the rule, it's what we do all the time with the people we see like this. So what I'm going to do, if I can hit share my screen, and there we go. Can you see me?
Yeah.
All right, good, good. So welcome to the Chronic Pain Relief Academy. I'm pretty excited about all of this. I believe, and maybe I'm wrong, but I believe that this is the biggest breakthrough we've had in, if you want to call it, neurology in history. There isn't anything that I know of that works like this. And not only that, but it's now available for the first time to holistic practitioners, where before I was only teaching MDs and chiropractors. And it's been a few years ago that I was doing that, but I taught about 1,400, and we charged them $8,000 for the seminar, and we didn't give them near what we give you guys. So it's everything's really changed a lot. And even after, the 14 years ago when I started doing this, we're still keeping the prices down. So I'm happy about that. So recently we were at a convention. Actually, it was oh shoot, it's slipping my mind, over there in Plano, Texas. And we were at the Changing Life and Destiny seminar. And they'd ask us to come and test people. And they said, if you come and test people, we'll give you a $2,700 booth for free. And I thought, well, that's a pretty good deal. And so we've tested people, and we kept track of what happened. And we tested 35 people, and our average was over 87% symptom free on the first visit. That visit, actually working on them, took 5 to 10 minutes. So those are the kind of results that we're seeing. I would say that pretty much sums up how well this is working all the way around. So if I told you that we developed a technique that relieves most pain in 3 to 5 minutes, is that something you'd be interested in learning? And I think that most people would have to agree that they'd like to know how to do something like that, even if they could only do it for their friends and relatives,
Right.
So when this happens, so what happens is we'll bring a patient in. I shouldn't call them a patient, because when we're doing holistic, they're a sufferer, not a patient. So when we bring someone in who's suffering in pain and we work on them, typically most or all of their pain will go away. If it doesn't go away, the thing that we're doing will not help them. So I encourage people who are working with me to test people for free. Now, we don't accept Medicare, we don't accept Medicaid, so we don't have any problems doing that. We're kind of on our own, and we're not doing manipulation, so we don't fall underneath the category with the chiropractors and the MDs. This is purely holistics, and it's licensable through the PWA and certified by me. When this person responds, we have them come back the next day. We look to see how long it's taken for the symptoms to, come back. How long it takes to come back tells us how frequently to see them. We already know that we can help them because we already did. And if they respond well, almost all of them will get well. And when I say get well, I'm talking about like get well, like 90, 100% symptom free. And that usually was in the first 2 months. So it tells us how frequently to see them. It tells us if they're going to get well. And then what we do is we set them up on a treatment plan, or a care program, I should say, that is about 2 months long. We have them prepay for that if they want to. They don't want to, that's okay, but we give them a 20% discount if they prepay. So what it does is it helps your cash flow right away. And if you're taking the seminar, it gets your money back. On that second day of the seminar, on the second half of the second day, we have you bring your sickest people in and let you work on the same people you've been working on and see how much better it works. This is a really fun day for me. I would never do that if it didn't work, because you guys are going to go, hey, look, he said this worked and it doesn't work. It works, so you'll like it. Oh, this is a girl. She is a real sweetie. This is real short. Watch this, and I think you'll get some idea of what we can do.
I am trouble speaking, and hopefully the doctor will be able to just me like before, and bring back my ability to talk. I couldn't walk or talk. I couldn't sleep. I couldn't write my name. And it's going to be hard to get through this. 2 years I spent like that. My life was over. I prayed for death every day.
She's a real sweetheart. Towards the end of care, I had some tickets to a Paul McCartney concert. A couple of them I gave to the patients, and she was one of them, and she went to the concert. I got another video of her out in the parking lot dancing, talking about going to the Paul McCartney concert. And anyways, this is the problem that we've identified, is the problem that creates fibromyalgia. Now, I have to qualify that. This is my work, what I believe. I don't want to make any outrageous claims, but I've been doing this for, since 2002, and just there's thousands and thousands of patients. Well, I know it works. So we originally identified this as a fibromyalgia condition. We started working on fibromyalgia, but we noticed that things were going away, like OCD, like trigeminal, CRPS, neuropathies, seizures. We haven't had a lot of seizure patients, I think around 8, but all of them, their seizures went away. So it's like that doesn't mean we're going to get rid of everybody's seizures. It just means the ones we worked on so far, they went away within the first week, typically. So that made me real happy to give her speech back. We see quite a few people get their speech back. So again, we did another study with manipulation, and in 2 months, we were 85% symptom free on 74 patients. And that was primarily on fibromyalgia patients. We've been featured on Fox News, WebMD, CNN, Forbes. Joan London did a special on my other company. We've been on Discovery, TLC, Disney. We've been around a little bit. This video features about 5 people. If you'd like, you watch this, I think you'll have a much better idea of what we're doing. And I've included, this is Dr. Jones. He's a great guy. He's a psychiatrist. We ended up becoming good friends, after the seminar. Anyway, I'll let you hear them.
This treatment was amazing. It was amazing to see people who are hurting, who are suffering chronically for years, and they get a breakthrough. Yes. You see people in chronic pain, acute pain, suffering, and all of a sudden it's turned off. As a physician of 50 years, that's rarely seen in any kind of condition, any kind of situation. So this is highly recommended. It's highly recommended for those suffering, those that have given up. As a psychiatrist, this is an excellent treatment for those that are actually thinking about giving up their lives, because there's relief is available. So we really recommend this doctor, his treatment, his methods, and I give my 100% endorsement. Amen.
Hey, I'm Dr. Michael Johnson. I've been in functional medicine and functional neurology since 1983 as an incredible seminar program. It's the NeuroMatrix program. I've been here out in Salt Lake City with him this weekend, and it's been great. I highly recommend it.
And then the second day, we actually got some patients here, and we tried it on them. And the success was, I want to say it was probably maybe 80%. I don't know. I have to think about how many clients we had, but we had quite a few. And they were so happy with the outcome. So I just can't wait to, get on board and have more clients come and help people.
My procedure today has changed significantly because before I could not even talk or sit or stand up for a long duration of time. So it's made a huge difference in the way I feel and look, even in my face and in my eyes. I hope that that will help others to understand that this is very important and they need to always have this done to stay feeling great.
How many procedures have you had done on your neck?
I have had about 5 neck surgery, cervical, 5 neck cervical C2 to C7. And I've had about 20 procedures on my shoulder, and I've had about 6 epidurals in my neck.
I have this fibro since 9/4 Joanne Foster Brownyard. I've been here for 8 days. Find that healing pressure. I was able to sit up. I was able to talk. I could not talk before. And I have no pain. I feel fantastic.
I feel like I'm fighting for my life every day. Turning, still walking, still level, still even. And my baby's getting me emotional. My name is Cleta Hurst, 11/12/34, and I'm 72, and it's been hell. I've been sent away or put away or took myself away till I could come back. I can't take it anymore. Probably 4 hours last night. I really slept. I got up by myself, dressed myself, got my own breakfast, and went back to sleep. And I'm feeling, 100% better. I just can't believe it. I'm having more fun, except I get tired fast. But by then, I've only been on a wheelchair. I mean, out of the wheelchair one day. I mean, partly out of a chair one day. And I'm walking a little bit without the wheelchair, except I'm afraid of balance, and I don't want to do
That
anything
is
dumb.
great.
Okay.
From the wheelchair in 2 days, from the wheelchair to walking. You're awesome.
My name is Kari States. I'm from Modesto, California, and I've had fibromyalgia for 11 years.
Can you tell me, can you show me your arm? What the problem you're having with your arm? Can you show me what happens if you take the weight off? Are you doing that, Kari?
No,
You're not doing that at all?
no,
That's what it does by itself?
yes, for 4 days. And that time, my pain level has been cut by about half. My arm has slowed down a lot. Used to be like a bird who was flying bird, and I don't have to wear a weight anymore. And I'm looking forward to. Yeah.
So Joy, how do you feel after your first treatment?
I feel good, much better than I did before, and just
And you episode while you were at the beginning of treatment. So how do you feel? How did you recover after that episode resolved?
Like a seizure?
Yeah.
Yeah.
I came back on my stomach because it was a little sensitive near my ears, but it helped me come back awake, and I was much more responsive afterward.
How long do the seizures normally last?
Anywhere from 8 to 17 minutes.
This time it lasted
less than a minute.
I was gonna say less than a minute.
While we were working on it.
Yes.
The interesting thing is you started the seizure before we started working on you.
Yeah.
And I grabbed your neck right away and worked on it and you stopped it.
Yes.
Maybe
Yeah, that too.
No, I understand this whole thing started with a spider biting your foot.
Yes.
And then it left you 3 weeks ago, and it left you with severe foot pain. You couldn't put your foot on the ground.
Mm-mm.
You can now,
Yes, sir.
and you actually took a step on it,
Yes.
Yeah,
which is like really what that means that you should be doing real well soon.
Yeah.
absolutely.
Does the head feel better too?
Yes.
You had a headache stuff going?
Mhm.
Okay. So after a seizure, normally you wouldn't be this alert?
No,
Okay.
I would not be able to talk to you.
So I think we found, what's really interesting is it looks like that spider bite set something off that triggered this whole upper neck problem, that we were able to take the pressure off the spinal cord structure, stop the seizure, stop her headache, and make her foot feel better. There's a whole theory behind all that we don't have time to get into, but
It's amazing.
Yeah.
there you go.
It's amazing.
I'm glad you're feeling better.
Thank you.
Thank you.
So those are, I think, some interesting cases. The little girl that just spoke, she was having grand mals every hour, 24 hours a day. And of course, parents, what they were going through. And so we sat and talked for a little bit. And when I put her on the table before we could get her to lie back, she had a grand mal and she was foaming at the mouth, and they always scare me. I understand they're just you can explain them away, but they're still just really, really scary. The lady who was Cleta that got up and walked, who was so sad when she came in, she'd been in a mental institution her entire adult life. And so that's why they're talking about they put her away. And she said, I can never be what they want me to be. And then she completely recovered and went back and lived with her family. And I called her a couple of years later, and she's at her family's house, says, I'm having a great time and I'm still well. And so that's so much fun for me. I just love that. Now, the blonde lady, she was speaking when she first came in, she couldn't speak, and she was leaning against the wall and barely able to stand up. And she just woke up and started running around and helping people. This can create, and all of you have seen this, the people who just look like somebody's taken the life out of them and just taken that dimmer of life and turned it way down so they really can't function. I believe that this is coming from what we would call a atlantomeningeal compression syndrome. Some people might also call it maybe an upper cervical spinal stenosis. It's not truly an upper cervical spinal stenosis that can be documented radiologically. At least it hasn't been so far. So one of the things I want to do is do a lot of before and after MRI, CTs, and create some documentation. Right. It just takes some help, from a lot of different people. And right now I've got more on my plate than I can keep up with. So I think that the meninges are involved, pulling on multiple nerve roots at one time. This causes widespread pain. You have multiple nerve roots, you can have multiple areas of pain. The meninges doesn't stretch. If you pull it out of its normal position in the upper neck, you can pull on nerves all the way down to the low back, and that's why these people can have full body pain. You release the meninges, the pain goes away. What we do with our test is release the meninges. We release it, the pain goes away right on the spot. And that's one of the reasons I believe that I found this, is because I can do that. And then we have them come back and work on them enough to stabilize it so it stays permanently. And so that's what we do. So that's kind of the short version. A little bit longer is that you pull in enough nerve roots, you set the sympathetic nervous system off. Now these people live in sympathetic day and night. That's why they don't sleep. They're in sympathetic. They've all got irritable bowel syndrome. Why? I'm talking about fibromyalgia right now. They've got irritable bowel syndrome because they're in sympathetic. That whole system doesn't need to be on when you're running and fighting. They lose their libido because they're in sympathetic. They don't need that system either. Now all of a sudden you've got a person with with irritable bowel syndrome, which leads to leaky gut syndrome, which leads to autoimmune diseases. Now we've got people who are on, who have rheumatoid arthritis, who have disseminated lupus erythematosus, lupus. We have just numerous things, including a lot of allergies that these patients develop. Now, I'll show you a little more complicated aspect of this that confuses me a bit, is that you can have a patient come in with CRPS, and let's say they hurt their knee, and they ended up going in for surgery. And after that surgery, they came out and they said, my knee is way worse than it was before. And the doctor goes, I did a good job. I do these all the time. I know I did a good job. And they complain enough that they'll go back in looking for scar tissue or something. This time when they come out, it's worse again. And you guys have all seen these too. And so anytime you do anything to that CRPS knee, it gets worse. We can release the meninges, and that CRPS will normally disappear 50 to 100%, typically more like 80 to 100% on that first visit. And then we know that we can get rid of that, and we know what's causing it. I've seen those so many times. It works just as well in trigeminal neuralgia. It works on about half of more than half of your neuropathies. I worked in a diabetic neuropathy clinic for a couple of days, just testing lots of patients. And about half of them there didn't really have diabetic neuropathy. They just had neuropathy, and they responded well to my treatment. The other half didn't respond at all. They had diabetic neuropathy. And so that's, you can see that's why we don't get 100% of the neuropathy patients. People say, well, what can you do with Alzheimer's or those Parkinson's disease and that kind of thing? We can't fix them. Those are real diseases, and I can't fix an Alzheimer's. I can't fix a Parkinson's. I don't make cancer go away. But typically we make the patients better. Usually a Parkinson's patient their tremors quit when we work on them. MS, I have a theory, and I don't know if it's right, and it's just a big theory right now. I think that there's a problem with cerebral spinal fluid flow that creates dead spots, and that's why they get the plaques. And that's why nobody can figure out why the plaques are coming. And with all of the research and all the gazillion dollars they spent on MS, there's still the big question mark. I think that's a good possibility. It's just something that's really, really hard to research, because what do? You take 1,000 people and work on them regularly and see how many out of the group get. It's a very difficult thing to research, but hopefully one day at least we can look in this way and at least get some help for these people. I haven't been able to work on enough to know what's going on. Weird things I see. I had 2 people I worked on got their sight back when I worked on them. I've had a couple of people get their hearing back. The sight back is just simply pulling on the optic nerve. You pull on the optic nerve hard enough, you won't see. And I had this one woman, I didn't even expect it, because she had fibromyalgia. I'm working, her fibromyalgia symptoms are going away. And she starts saying, I can see better. I can see better. And I literally, the test usually is 5 to 10 minutes. I just stayed in there with it for 30 minutes. In 30 minutes, she was seeing perfectly again. And I think it's just pulling on the optic nerve. So there's just so many things that are out there. So people say, well, what things can you help? I said, anybody has any pain, has any weird thing that nobody can help, bring them and test them and see if it works. Don't charge them, just test them. If it works, you can get them well. If it doesn't work, you're probably not going to be able to help them at all. And so you find somebody else that can help them with something else. This is a picture of the spinal cord, and you can see the nerve roots that come off on each side, and you can see where they pass through this layer. They've got a couple layers of meninges they're showing there, and you can see how that seals against those nerve roots. And if you were to pull on those nerve roots, it takes very little pressure on those nerve roots to create symptoms. It's kind of like hitting your crazy bone. If you hit it hard enough, it really hurts. But you can touch it very lightly, and you can feel it'll change the sensation in your fingers. Well, nothing happened in your fingers. It just went from the nerve root to your brain. And this is what happens with these people. You can cut a leg off and have phantom leg pain. We go in and release the meninges, and the phantom leg pain goes away in almost every case. That's a really nice thing to work on. I haven't seen much of that myself, but I had a doctor I trained back east who was working with vets, and he saw quite a bit of it. He said it worked well. Now, I don't like talk about money, but I'll talk about money just so you get some kind of idea, because you've got to run a clinic. The average person spends about $5,000 in their first 2 months they're there. And the way that happens is that we set them up on a care program. Typically, after their 20% discount, the first couple months cost them about $2,500. And then at the end of the 2 months, we give them the option to cover the rest of the year. It usually takes somewhere around another 2,500. So let's say it's 5,000. The reason I'm telling you that is that if you pick up a new patient every week, you've added 20,000 to your practice. If you pick up 5 patients a week, you add $100,000. And the reason I'm using those figures is that we have programs where we put people in medical offices or teach you how to do it yourself. And so you can go into an office that has lots of sick people, like a medical office, have lots of people in pain. And if they refer over, let's say, even 3 people a day, which would be really easy, and you just signed up one, that's $100,000 a month practice. And we actually will, you can do that yourself, or what we do is we will team up with you and and if you find an office, we put you or somebody else in that office, and then we split our profit with you, which works out pretty good. The doctor does pretty well. With one new patient a day, the doctor picks up an extra $45,000 a month, and so do we, and we split that with you. So that's something to think about. Anyway, give you some kind of idea how you can pay your bills. So this is a new profession. It's for you. It's a new profession, and if you've been wanting to help these people and haven't been able to, you're going to be doing things that even the MDs and the chiropractors can't do. And you don't have to go, and you get paid like an MD or a chiropractor, and you don't have to end up spending the next 8-9 years in school to do it. So build a new life, become a professional, and be treated like one, and you can do miracles. All the things that I showed you on here, this is not exclusive to me. You can do the same things, and that's why we have you bring sick people in on the second visit and help you with them. So if you're interested in getting started, but I'm looking for some compassionate people. I love working with compassionate people who love people who get people well. Yes, it makes money. There's nothing wrong with you making money. And for them, it's the cheapest money they spent getting well. And so it's kind of a win-win for everybody. So if you're interested in changing your life, here's my phone number. Oh, wait a second. Yeah, that's my phone number. I'll give you another number too. You can also reach me at 530-307-2398. I tell you that because this is my new business number. I haven't tried it out yet. Just in case it doesn't work, you can do a 307-2398.